Hi, everybody. My name is Sam. Welcome back to Sam's Healing Podcast. Today, I'm joined by a fantastic guest, one of the few guests that actually overdresses me, and he is Dr. Hedelius, who runs the Paradise Creek Treatment Center in Idaho. Dr. Hedelius, thank you so much for coming in. I'm ecstatic to have you in.
Thank you, Sam. I'm happy to be here and part of the show today.
So for those that don't know you, for my little viewing audience that's going to get introduced to the wisdom and the experience that you have, why don't you share a little bit about your treatment center, what you do, your history, all that fun stuff?
Sure. Thank you. So Paradise Creek Recovery Center is an 8-bed facility where we treat men, adults 18 and over, who have all types of problematic sexual behavior. So that can range from your organic problematic pornography use, compulsive pornography use, on up to chronic affairs, online offenses, some of the more difficult things to talk about, but yet still issues that need to be addressed: voyeurism, exhibitionism, child pornography. The most correct term is child sexual abuse images now. And so we see a number of these men every month, and they come from around the country, some outside the country, and they stay for 45 days or beyond. And we address their problematic sexual behaviors. We also address trauma, because most of these guys have a history of trauma that is part of their story. Many of them are in relationships with partners where they desire to try and reconcile, or where they're maybe considering whether they can reconcile. So if that's the case, we also address those dynamics as well. And so it's a fairly intense program, daily individual therapy, at least Monday through Friday, multiple groups per day, and then there's groups on the weekend. And so they're getting about a year's worth of treatment in about 45 days or so, in a very precise time period.
It's fantastic. Anytime you can take a year's worth of good therapy in 45 days is fantastic. I was watching one of your videos, and you had talked about an assignment that I guess we'd call them attendees, would do. You called it an autobiography. You talk about how we have fractured and ruptured attachments, and that many times we forget about some pretty traumatic events in our life. Off camera, we were talking about how I had really blocked out of my mind my own childhood sexual abuse at 11 years old. But I thought it was brilliant, the concept, and it speaks to how we, as unfaithful or addicts or both, will, is it safe to say, repress these memories? We'll block them out. We'll utilize, not utilize, but dissociative amnesia. So maybe you could talk a little bit about that and about the power of that assignment.
Sure. Yeah, thank you. So there's really two reasons for that autobiographical assignment. One is that it does tend to be something that can encourage people to think about things that they haven't really thought about or been conscious about for years. And we are not the kind of therapist that likes to dig into memories and bring up suppress or repress memories. Our philosophy is, if the brain needs to remember it in order to get better, it will. And we ought to allow that to be a fairly organic and natural process. And so when going back and writing a life history or a biography is a good way to just to see what comes up. And oftentimes memories from the past do come up. Sometimes they're traumatic memories. Other times, however, they're very positive memories when someone has got to the point that they're with us and they think, gee, I didn't have any good experiences with mom. Then they start writing a biography and they remember, oh, Mom tucked me into bed that one night and she made cookies and whatnot. So it is a good way to help the individual start to become a bit more insightful and honest with himself. But another very strong reason for the biography is that it helps to put the brain in more of a softened spot so we can start to repair a lot of these attachment fractures. And a lot of guys coming in haven't so much just experienced concrete trauma where they were abused physically or verbally, but sometimes it's just the bumps and bruises of a fairly chaotic environment and a lack of nurturing. And if you think about how we grow psychologically and emotionally, we grow because we have a story to tell. We come home from school and we talk about the good things and the bad things, and hopefully we have a parental figure there who's able to stop what they're doing and listen to us, validate us, hear us. We feel felt, they feel felt. And that teaches my nervous system that, there's someone there for me.
Right.
Or if I'm hurt and I get dysregulated, I come home and mom or dad listens, and I learn that the facts are friendly. But in developmental trauma, oftentimes that doesn't happen. Or sometimes it does happen and it's very intermittent. And so we get into adulthood and we learn that we really don't trust ourselves, or we have a hard time trusting somebody else, feeling like our partner doesn't understand us or whatnot. So as someone comes in and writes the biography, we then have them read the entire biography to us word for word. And that takes several hours. And that process of just having someone listen to us, so the patient, they write it, and then they read it to us, and they hear it, and they see us hearing and listening, and we comment on it. That starts to soften that nervous system a bit. So a bonding and attachment process starts to take place in a therapeutic setting. And we realize that we're only there for 45 days and whatnot, but it can set the stage then for them to take this outside and start to learn how to disclose appropriately with boundaries in healthy ways to friends or to family members, or ultimately a partner if that exists, to help to start to rebuild and repair some of the attachment fractures.
So you said something, we didn't talk about this off camera, but you talked about nurture. And as I have done my own work and doing a lot of, some would call it reparenting, inner resourcing, as some would call it, I have realized my young life was void of a lot of nurture. It affected the way I grew up. It affected my marriage. In in your opinion, how important is nurture to that development? How much pain and hurt do you see in those that attend your treatment center, or even just over the scope of your professional career? How vital is that nurture piece?
Yeah, I don't think we can overstate the importance of nurture. Now, if you take your basic Child Development 101 or Psych 101, you'll hear this nurture versus nature argument, and it's been around forever. Both are important. We can't underestimate that. But nurture is crucial, and it starts at the very moment of birth, and it's crucial to the entire nervous system. So our functioning as adults, as individuals, it's really not just our brain, it's the entire nervous system that we are embodied in. And so often we'll talk to our folks about this model of interpersonal neurobiology. That's a model of not necessarily treatment, but of understanding human behavior that was developed by Dr. Dan Siegel out of UCLA. Right. And the basics of interpersonal neurobiology is this, that you and I are who we are, for better or for worse, as a result of our relationships. So studies have shown that take a mother, whether she's right or left hand dominated or dominant, most mothers are going to nurture or nurse their babies on the left side. So if you think about the right brain, the right limbic system is the relational brain where attachment takes place. So if a baby is on the left side of the mother, right ear and right eye is covered up by the breast. As mom is talking to the baby and the baby's hearing the mother's voice, it's being processed through the left eye, left ear, which is connected to then the right part of the brain. And so that starts that right brain developing at a very young age. And that's what part of the brain is on in mom or dad when they're holding the baby. And through that process, that starts that nurturing. Now, let's just say that mom is having her own emotional struggles or conflict interpersonally or something. Maybe she's stressed and she's not able to nurse, or she's, and this isn't about nursing right here, but even post-nursing months and years.
Sure. I mean, my dad came home from Vietnam. They were going through a massive divorce when I was super little. So any type of traumatic crises, right?
Yeah. If the caregiver is just not able to show up and be present for the child, then that affects that nurturing system within the nervous system. And so what happens is the child begins to not have this neurobiological mirror in terms of who he or she is and what they're developing into. And the one thing that we do need in life to be okay is we need to know that we're not alone. We need to know that someone is there. And so in that regard, some conflict is normal and healthy. And so if mom or we won't pick on mom, we'll pick on dad. Let's say dad and the child, they are getting along well, but there's a rupture. It's not the rupture that causes long-term pathology. It's the absence of repair. So if dad never comes and talks about last night when he yelled or when he got upset, then the child is left to wonder, is that me? What was that about? And instead of the nervous system going up like this in arousal and coming down during a repair, the nervous system goes up and stays elevated for an extended period of time and then comes down slower. So the body then develops a bias towards that sympathetic nervous system, which is the arousal nervous system. And then what happens is the only way that we can start to bring that nervous system down is through something artificial. So gambling will bring it down, sex will bring it down, food, high risk behaviors. And that's where these addictive or problematic behaviors start to come in because they're self-regulatory to say, I've got to regulate this nervous system. And deep inside the brain says, oh, this is a man or a woman whom I can have sex with or put money in their underwear and they like me, we think. And so it's a pseudo sense of relationship that starts to kind of bring that nervous system down to a more regulated state.
Is it fair to say, and all of that is fascinating, like I'm putting myself here thinking about my childhood growing up, what I know my mom and dad, and, they were coming home from Vietnam. They didn't know any better. It was mass chaos. There was alcoholism. Is it safe to say, I'll say we as addicts, that we love to avoid feelings of shame, one down, worthlessness, inadequacy, failure, and that is oftentimes why we use. Now, using could be any of what you've just mentioned. It could be multiple affair partners or an affair partner. It could be drugs, what have you. Is it safe to say that in many ways, addiction is about avoiding feelings that maybe even started in childhood, like what you just described?
I absolutely. Years ago, I met a psychiatrist by the name of Dr. Colin Ross. He's out of Texas somewhere. I don't remember where. But he introduced himself as a recovering psychiatrist. And course, he was trained in prescribing medication, but he changed to just providing psychotherapeutic treatment as he started to realize that most psychopathological disorders grew out of some sort of developmental trauma. And he used to say that the problem is not the problem. And addiction is about trying to avoid the real issue. Or addiction is about not facing whatever the real issue is. So the real issue may be this intermittent and inconsistent treatment of parents. Sometimes they're there and emotionally nurturing, and sometimes they're not. That confuses the nervous system like crazy. And so the brain just says, well, I'll find something consistent. And I've learned that this alcohol is consistent. Every time it does exactly what I need to do, or the pornography or the sex worker or whatever I pursue gives me that regulatory processing that they're seeking.
I just love the level of intelligence, but practical approach. So for someone who might be listening or watching and they're like, okay, Dr. Hedelius, you got me. I'm trying to avoid my massive feelings of inadequacy. I feel like such a failure. And so I go to pornography, for example. So that people can get acclimated to you and your approach. I have several guests and they have different approaches, and there's some consistencies throughout, of course. But in terms of someone who is like, man, or maybe they can't break free of the affair partner. They're trying, they know it's costing them, but this sense of self-soothing or this regulatory type approach, how does someone that is in that, who maybe can't go to your treatment center yet, but on a practical level, what are some of the things that they could do to start to, and I'm going to say this, it's going to sound oversimplifying, but how can they start to create some freedom? How can they start to do some work?
So I would, at the outset here, I would address this answer to both we'll call the addict and the partner. And what I would say, first of all, is that don't think that it's too late. And if you can find any room for any hope, hold on to it. And certainly the partner, the betrayed partner, is in full swing trauma, betrayal trauma. Their nervous system is going crazy and whatnot. And so likely they're either in a fight, flight, freeze, or appease response. You know, we're fighting, we're running, we're freezing, I'm just numb, or I'm appeasing. I'm going out and changing my wardrobe and changing my personality to try and win this person over. And my advice would be for the partner is just try and catch a breath for a moment and just get the nervous system grounded. And for the addict to recognize that what you're experiencing, again, is not too late. There's not time to waste, but there is ample time. There is time to get this taken care of. Doesn't have to be a death sentence, but we do have to get after it. And if both partners can give one another some time and give the relationship some time, then both can start to learn to re-nurture that relationship with their self. And it's probably going to have to be done with someone in therapy, and preferably someone who knows a lot about attachment and neurobiology. And it's interesting, I finished graduate school in 1998, and graduate schools at that time really were not talking a lot about this stuff. No. About attachment. I mean, you got a few weeks of it in human development, but in terms of treatment, it wasn't there. It was strictly CBT. And I'm getting off topic a little bit here, but I started to cue into this during my clinical training when I was involved doing my clinical training at a clinic that was strictly cognitive behavioral. And the paradigm of the office was kind of that attack therapy. And I noticed that these guys were court ordered. The therapist would come in and they would just go after these people and they would say the right thing. But I looked at their body posture and their arousal level, and their sympathetic nervous systems were on such high alert. I thought, these nervous systems are in the same place that they were at when they were victimized themselves and when they were abusing others. And this was right in the time that I was taking biological psychology, physiological psychology. So I started to study this dynamic on my own and realized we've got to go deeper. And so if a couple could maybe just accept a little piece and say, this is beyond just men behaving badly. It's really about an individual who, in an unhealthy way, is trying to repair damaged and fractured attachment. And if they could just start to hold on to that paradigm for just a moment, then some healing can start to take place. And that's just the beginning. We've got a long ways to go after that. That's where the real work goes or comes in. But that can start to slow the nervous system down so they can listen to the wisdom of the body and the therapeutic process a little bit.
I have several guests that come in. I've got several friends, obviously, in the industry. You just focus so much on the nervous system. I mean, the betrayed partner, their nervous system is constantly being zapped with triggers, reminders, intrusive thoughts, and missteps, hopefully not relapses, but regressive behavior on the unfaithful. But you also talked about the unfaithful or the addict, their nervous system. So as we're kind of winding down, talk to us about what's going on in the nervous system of the addict or the unfaithful, because you don't hear a lot about that. There is so much focus on betrayal trauma, and rightly so. There's so much focus on self-regulation and co-regulation and helping the betrayed partner stay in their body and understanding the body keeps the score. And there's so many different things, but you alluded to the fact that the unfaithful is their nervous system is on overdrive as well. So maybe that can help the betrayed partner understand that the unfaithful is not in their body or in their right mind oftentimes as well, right?
Right. Yeah. So all of our nervous systems are programmed to follow natural bell-shaped curves. We get stressed and it comes down, stressed and we recover. Polyvagal theory, that's kind of how that plays out. But in the nervous system of an unfaithful individual or an addict, we're not having bell-shaped curves, we're having spikes. And so we get stressed and it goes up, and then it either comes down through artificial use, pornography, sex, addiction stuff, whatnot, or we just get stressed and it just stays up. And that starts to eat away at our cellular tissue, and we're not coping well at all. And so when the nervous system is up high, what we have to realize is that this prefrontal cortex is not functioning. Right. So I'm not thinking about what would be the right thing to say to my partner, the right kind thing or the empathic. I'm just thinking about me and protecting myself. And a lot of things are said in that high state of arousal. And so if we can just, if the addict, the unfaithful individual can just take a moment, we often say, we hear people say for years, take a breath. What does that mean? Well, taking a breath starts to slow down the nervous system and activate the parasympathetic, where I can then get more access to this upper brain and say something. And ultimately, what we're really trying to do is get this right brain in one partner connected to the right brain in the other partner. And something interesting that you may want to look at for another show is recent studies show that in therapy situations, when a therapist and a client are connecting, that their right brains, which is the relational brain, they both actually start to light up simultaneously when they're in that part of the therapy session. And that is the exact same process that happens in relationships between mothers and babies or fathers and babies. But that's the thing that isn't going on between the partners. So we can slow it down and have some empathy, then they can start to connect.
That's so fascinating, which is why for those that really connect with their therapist or their coach, there is this chemistry, there is this unity, right? That makes them feel, and this is a simple but big word, that makes them feel safe, right?
That's the word right there.
So as we kind of wind down here, I was watching in one of your videos, and then we talked about it. Just two little quick things. As you said, becoming an addict or coming to your treatment center is not a death sentence. It's a life sentence. And then you talk about, this is a moment to say, what are you going to do different? So maybe for those that are watching and listening, whether they're the betrayed or whether they're the addict, maybe you can speak to how, even though you might be an addict, or you may have to come to the realization that you have addictive tendencies, what have you, that it's really not the end of your life. It's not really a death sentence that says there's no hope for you, and that there's no hope for the betrayed party, right?
Yeah. One of my favorite quotes by George Eliot is this, and George Eliot was actually a woman, went by George Eliot, was her pen name in the 1800s, so she could sell her books. But she said, it's never too late to become what you might have been. Now, every one of us can look at our lives at 20 and 30 and 40, after the first divorce, after the second divorce, after the incarceration, after the job loss, after everything. And we think of what we wanted and what we didn't get and what we should have had. But I truly believe that is correct thinking, what George Eliot said, that it's never too late to become what we might have been. So it's never too late to find connection. It's never too late to apologize. It's never too late to trust. And trust really is built on a simple principle, and that is, trust is built as we have predictable and consistent behavior over time. So if I can start to see consistent behavior over time in my partner, that then becomes predictable, which I can then trust, and my nervous system relaxes. The reason why my nervous system is on high alert is I don't know if he's going to come home with perfume on his body or not. Some days he does, some days he doesn't. But if I can have a high degree of predictability that he's home when he says he's going to be home, and he's on the business trip when he says, then my nervous system calms and I can heal. And it's really the same process for the addict and the betrayed.
So I hear you saying, I tell clients of mine this, a superpower of the unfaithful in one sense is predictability. Another one is consistency, right? You're home when you say you're going to be home. When they ask you what you had for dinner, you say what you had for dinner, and you're rebuilding trust and reliability. And to me, you have focused so much on the nervous system that I think is just a great reminder to those that are, you can do all of this work, but if your prefrontal cortex is offline, and if you are stuck in what we would call flooding, triggered mindset, nobody's really communicating. We're just damaging each other, right?
Right.
So as we say goodbye, how can people, if they're interested in your treatment center, if they want to know more, if they want to find out, maybe there's an addict who's like, this might be the place for me. How can they find out more information about it?
So the easiest place is to go to paradisecreekrecovery.com, and you can find us there. Google us, paradisecreekrecoverycenter.com. And like I say, we're in southern Idaho. Generally, if someone called, they would talk to the front desk, and then we would have our program manager, Jacob Stacey, call them back and walk them through the process or answer any questions. If they want to speak to me, they're welcome to do so. Just ask me to call them, and I generally will not be at the front desk answering the phone, but give them a call back within a couple hours or maybe sometimes the next day. But would be happy to answer any questions, just anything we can do.
That's fantastic. If you're going to be sitting at the front desk, I'm going to be calling you a couple times a week for some advice with clients. I can tell you that. If you're that accessible, we're going to be close friends. I'm honored that you would come in and share your insight. I have found this to be educational, but insightful for both parties, whether you're an addict or just someone who is unfaithful. And I want to tell you that are watching or listening, as Dr. Hedelius said, maybe it's not too late for you, but the time to take action is now. And the time to do work and to do the heavy lifting is now. If I can help, you can reach out to me at samshealingpodcast@gmail.com. If you would like more info that I can get you on getting to the treatment center or working with me, by all means, reach out. Thank you so much for tuning in. Dr. Hedelius, I hope this is the first of many visits into the podcast. So thank you again.
Thank you, Sam. I appreciate it. Thank you.